We are now live. Perfect. Hi, and welcome back to another installment of ENTP Live. This is one of our live editions. Typically, I do a video of the week on Sundays, and I follow up with a live on Wednesdays, but today's live is a little different. We have a panel and some guests where we're doing some open consulting. I get reached out to from time to time to kind of give direct consulting, and it's not something that I really do, mainly because of time constraints. And I usually try to encourage those who are asking specific questions to join us live so that at least if I'm going to be consulting for free and have the time to do so, it's actually in the public space that everybody can benefit from it rather than it just being one person benefiting. So today we have a few special guests on, and it's actually a full range of the type of home care operators that you may come across in your life. First, we have Sean, who's Savvy Business Check. Sean is the founder of a home healthcare agency. She focused on pediatrics for a point in time. She had a successful exit from that and is now on the consulting side, helping startups and helping agencies get started, as well as consulting on growth strategies and really how to make it within the home healthcare space. We also have Cassandra Adams, which I believe has some sort of relationship with Sean. She's in the early stages of getting started and has her unique set of questions. And it comes from the point of view of the newbie, right? So a lot of you who are following me on this channel are newbies in the space, are looking to get started. So some of her questions may mirror the questions that you have. So her questions will definitely resonate with you. We also have Eva, who is part of a family business, and her story connects very much so with mine. Her parents started a home healthcare agency in Atlanta. They're growing, and they're now facing like that first kind of growing pain that most operators have, especially those who are getting started, who may not necessarily be from the home healthcare space. You guys who are doing that are doing it just the same way that me and my mom were. You're learning as you go. And with that, things kind of move slowly. You're going to make mistakes. Things are going to happen. So that's the phase that they're in now. And they have some traction, but they really want to take their business to the next level. So their questions are going to be geared more towards that. So we have, as I said, a pretty diverse group of people here, all with their own stories. They're from different cities, but the rules apply. I'm in Fort Lauderdale. Sean is in the Metro DC area. Cassandra's in Charlotte, North Carolina, a city that I love. And Eva she's in New York, but the business is in Atlanta, Georgia. And so thank you guys for joining us. That gives us, I guess, sets a tone for what we're going to be covering today. And I really hope that what we do cover is going to be very useful to those who are watching. There's going to be multi-million-dollar advice being given here today for absolutely free. Take advantage of that. Share this video with anybody that you know is a home care operator or looking to get started. There's definitely going to be information here that is going to help them either grow their business or avoid some costly mistakes. Just a few housekeeping things before we get started. ENTP Life is a channel that I developed really to highlight the Myers-Briggs personality type of ENTP, which I am. But what I do here is I mostly talk about real estate investing, my business ventures, and ultimately how I go about making money so that I could live a fulfilling life or live the life of my dreams. And this is what this channel is about. So if that's something that resonates with you and this is the first time that you're coming across the channel, make sure that you like and subscribe. Second bit of information is that we are launching a new program called Passive Workforce. Passive Workforce is a tutorial on how to start a healthcare staffing firm, which is different and in some ways similar to home healthcare. Less regulation, just as profitable. And it's something that I think is easier to start than home healthcare, regulation, and so on. So I decided that rather than trying to coach people on how to start home healthcare agencies, which is a heavy lift, as those of you who are here know, I decided that I'm going to teach them how to start a healthcare staffing firm. That's where my company started. And that launches June 27th. So if you are interested in that, just reach out to me via comment, email, and I'll put you on the list so that when that comes out, you get to take advantage of discounts and be the first to participate, etc. All right, enough of the random ramble. Let's kind of get into it. First, I want everybody to introduce themselves, just to what are the high level points of who you are and what you're doing, and why it is that you're in this home healthcare space. So I'll start with Sean and make my way around the square.
Hey everybody, and thanks Karl for having us on your platform. And when you go to church, they have a guest speaker. They always say thank the pastor. So we thank you for having us on your channel. And I go by the Savvy Business Chick on so many social media platforms. In 2006, I started a home health care business from scratch, which what Karl said, with the focus of pediatrics, which is really heavy here in the Washington, D.C. area. And within 22 months, I grew that from turning in my application to almost 2 years. I grew that to a seven-figure business. So right now I'm helping aspiring entrepreneurs and emerging entrepreneurs get in the same space that I have been in for the past 15 years.
Okay, thank you for that. And over to Cassandra, a little background on yourself, where you are.
Yep. Hello, everyone. My name is Cassandra Adams. I'm located in Charlotte, North Carolina right now. I moved here this year in the year of January. I came originally from St. Louis, Missouri. I am beginning my process of doing a healthcare agency with kids and adults. My healthcare profession has always been in the healthcare field, as far as the hospitals, assisted living, home healthcare, and just taking care of people, elderly, and things of that nature. I'm willing to start my home healthcare business. It's a start for this year. I will be doing a license class about next week. I already have the logo and the name already picked out, but I can't launch that name out just yet until I take the steps for that. But it's amazing. Like, I'm just ready to get started. I'm still starting. I'm just focused on it, and I'm thanking Karl and Shine for bringing me onto this channel.
Perfect. Thank you for joining us.
Thank
Diva?
you.
Hi, everyone. And again, thank you so much, Karl, for having me here and letting me use this platform to learn and continue to grow. As Karl said, my family has a home healthcare agency that serves the Metro Atlanta area. We are just really looking to grow and take our business to the next level. And Karl has already given some insightful tips, and I know he's going to share even more gems today. So I'm super excited for everyone to kind of hear his words of wisdoms, as well as Sean. So I have a lot of questions, and I'm eager to get started and hopefully help my family continue to grow our business to serve people in the community and to help these folks that need people to help them in everyday living.
Awesome. So the way that I kind of want to start this is we're going to kind of focus on the startup process first, and then segue into, well, after the start, sort of what could you expect when you're launching your agency and growing your agency. So Cassandra, what would you say is like your number one question in starting your agency, and why?
Okay, my number one question is probably for everyone that's viewing or people that's interested in. Everybody want to know the low ends of how a home health agency is not successful in the business. So what are maybe like 5 basic things that would make somebody in the healthcare field, as far as a home healthcare agency, unsuccessful in the business? Like, what are their mistakes, their disadvantages in it?
Okay, I think what I see as far as being the top 5 reasons, I'll kind of list them off. I don't have them in order, but what I see across the board is that most home healthcare agencies start without having enough insight into what works in home healthcare, if that makes sense. They are kind of drawn to the field either because of their heart, they worked in the industry, they've been home health aides, nurses in the industry, but on the field side and not really understanding the administrative side, how to manage, and all the details that go on in the back office. Their hearts are in the right place, but their business savvy isn't quite there. And because of that, they usually lead with their heart and don't figure anything else out and kind of get stuck managing a small caseload of patients and not really being in a position to systematize their processes to allow themselves to grow. So they hit a ceiling because they just can't do everything by themselves. Another thing that I think causes startup home care agencies to fail is being undercapitalized. In most states, it doesn't take much money to get started. Like the licensing fees are relatively low. And starting a business is relatively inexpensive. So people end up starting undercapitalized. So they don't have enough money to hire the necessary support or have enough money to pump into growth. And because of that, they end up doing everything themselves, right? So it kind of pushes them back into being in that first position where they're wearing hats that they're not necessarily built for, right? A lot of nurses are just clinicians. For instance, a lot of nurses start home care agencies and a lot of them only know that side of care, right? Documentation may be on point, but they wouldn't even know how to put together a spreadsheet, a basic spreadsheet, right? So they're lacking those skills and they can't afford to hire somebody that has those skills, and they kind of do it by themselves and just kind of implode. I would say those are probably the top two. Sean, what else would you add to that?
Those are great responses. I would add not knowing the regulations, because a lot of times people, if they bought policies, we talked about this before, that they did not read the policies. And so even after the initial survey, they may be doing things that are not in compliance. And then you get maybe a client that's been in the system and they know that you're not supposed to be doing certain things, and then they report you. And then, like Karl said, then you're working backwards because you have to wear these many hats, and all you really were trying to do was go out and provide care. So they don't assess risk, and they're not in compliance. So that's and another reason I would say is that they don't know how to recruit their caregivers. I had a recent client say, I'm going to wait till I get the client to post an ad on Indeed. Well, that just made me scratch my head, so, because, nurses aren't just waiting around. If they applied at your agency, they're going to apply at 5 other agencies. And the first agency they gave them the job, that's the one they're going with. And so I know someone that she ended up going out of business because she couldn't keep nurses. They came for the interview, and then they said, yeah, I'll go to Miss Smith's house, but they had already picked up another case. So I would say those are my reasons why they do not succeed in the startup phase.
Yeah. And I'm going to see if I can think of a fifth reason. Believe it or not, most entrepreneurs and founders are petrified of sales. And they're not willing to promote themselves in their business, right? So if nobody knows you exist, you're not going to get any business. That's just how it functions. And someone very rarely are you going to get that random call because your name was listed in some sort of directory and someone is soliciting service from you. That's going to be like a 1% or less of your clients are going to come from that. Okay. So not being comfortable pitching yourself and selling yourself is probably another thing that kills a lot of agencies. They think that they could just open their doors and somehow business is going to miraculously arrive. It doesn't work that way. So you have to start getting comfortable with being a salesperson. And being a salesperson, just to touch on this a little bit, being a salesperson only consists of you making an effort to say, this is who I am and this is how I can help. You don't have to be super slick as far as your speech is concerned. You don't have to necessarily be comfortable presenting in front of large crowds. All you need to be able to do is say, I am this person. These are my strengths. This is how I can help you. Do you have anybody or do you have this need for the service that I'm providing? And you just have to say that over and over and over again. Don't be afraid to promote yourself on social media. Don't be afraid to talk to your friends and family. Don't be afraid to walk up to the person in the pharmacy that looks like they're struggling to make sense of their prescriptions to find out what their situation is and talk to them about you being a home care operator, and maybe there's something that you could do to help. Even if they won't convert to a client, be comfortable talking about it, be comfortable giving out your information, because you never know if that person that you're talking to ends up passing it on to somebody else who actually needs your services. So you have to consistently put yourself out there and be your own sales rep for some duration of time, if not forever. So that's probably another, I think that rounds out the top 5, absolutely. What else do you have on the table, Cassandra?
I guess we can go to the upside of it. So what makes a healthcare agency successful?
The opposite of what we just talked about. Being well capitalized to begin with, right? That way you're able to afford quality help. We've all done it. Most entrepreneurs have done it, where they're looking at how much money they have and end up making their decision to conserve that capital. So they're looking for the person who's willing to take the lowest salary, and the person who's willing to take the lowest salary typically sucks. So we end up hiring a bunch of crappy employees that really can't do much and still depend on the founder to make sense of everything. So like now they're eating money out of your company and you're still doing double the work. It doesn't work that way, but we all do it because we're like, all right, this is the blood, this money here. And I can't give it up so easily. So, and that's usually because you have too little of it to start with, right? So being well capitalized for your particular market and the type of company you want to be is really important. Being comfortable selling yourself and your company is another thing that the successful agencies do. And on top of that, one thing that's not the opposite of what I stated before is that the successful businesses are more systems driven and willing to invest in growth than the non-successful businesses, where they're willing to take the money and pump it back into the business itself, understanding how that money has a direct impact on their growth, meaning they know their key metrics. They know their cost to acquire a customer. They know the lifetime value of a home health aide and how long a typical home health aide will work within their company. They know all their metrics, so they're able to make informed decisions on how to use their money within the organization. So let's just say a company knew that one marketing rep can produce 10 starts of care per month. And in that particular market, one long-term care life long-term is worth $15,000, right? They could say, well, if this marketing rep is able to produce 10 starts a month, and that creates $150,000 worth of value to my organization, what am I willing to pay this marketing rep to do so? And how much am I willing to budget in them to hit that number, right? And the average rep produces 10 starts a month, let's just say, right? If that's their organization, if they know all those metrics, they can measure the performance of that rep compared against the whole to say, is this person performing or not? Are they producing or not? And they can say, well, I'm willing to pay this person $10,000 a month because, I'm paying on average $1,000 per start, and that start is worth $15,000 to me. So you're not going to be afraid of pushing money into marketing because you know what the direct output is. And since like a lot of founders aren't necessarily admin or kind of metrics driven, they don't think about it in that way. And all they see is the salary. They see the 6-figure salary and they go, wow, I'm not even making 6 figures from this company. How am I going to pay this person who might just be blowing smoke? Because they have never tested it. They don't know their numbers. And if they just don't do it. So really knowing your numbers and also establishing clear systems that have the same output every single time is important in the startup phase. You want to add to that, Sean?
Yeah, I definitely agree with you on the systems. It's the difference between you know, running your business like a mom and pop to actually, you know, establishing yourself as a legit small business. And your office staff and even your field staff would begin to respect that. You know, you don't have your timesheet in by this date, you ain't getting paid, you know. And it's just it's not even being, you know, really rule oriented or policy driven, but it's, you know, this is just how we do things. So if you miss that slot, you know, you gotta, you know, come next week. I also agree with you that a lot of what makes, I think, home care entrepreneurs successful is really focusing on their business and not getting too involved in working in their business. You have to step away. And when you're just getting started out, like Karl said, and it's just you and you're starting to build your team, if you're undercapitalized and you're doing everything yourself, you don't know how to delegate. You don't know how to let things go. So when it's time to let things go because you're starting to get burned out, you can't even tell somebody, well, I know XYZ happens because it's up here, but it's not on paper. It's not in a report. And a good CEO is looking at those things, and they may have somebody else bring it to them so that it doesn't stay up here. It doesn't stay in their head, so they can't even go on a vacation because, you know, only Sean knows, or only Karl knows, or only Eva knows what goes on right before payroll. So that's why those systems are really important, and they really run it like a business. They don't run it like you're self-employed. They don't run it like I'm self-employed and now I just quit my boss from such and such rehab and now I'm the boss. No, you're running it like a business. You're running it like other people have to participate in that business. And they're always forecasting. And so when you're always forecasting, you have to talk to other people who are thinking bigger than you sometimes, because if you talk to your staff, they're fine. They don't want you to give them any extra work. You know, so no, Miss Eva, no, Miss Cassandra, no, we don't need to do that. We're fine right here. Such and such client is satisfied. But like Karl said, if you're trying to grow, then you need to talk to someone else. You need to get you a mentor, an advisor, a consultant. You need to set up a board and get like an advisory committee and have some people tell you some things on a quarterly basis at least, and even be reporting to them. Yeah, so they can tell you, oh, well, why haven't you fixed this problem yet? And you're always problem solving. As if you're a successful CEO, you're always problem solving, because
that's the main job.
Yeah, that's your main job. Yeah, that's your main job.
To problem solve and execute on what the board has approved.
Yeah. So for a startup, you know, maybe find you some people that can be on your advisory committee. I always say pay them. You know, people try to get out of, oh, well, pay them, even if it's pay them per meeting. You can't give them a salary, pay them per meeting. You don't want that free advice when you're trying to build a 7-figure business. I told someone today, free advice is going to be at that level. And if you want to stay at that level, then keep getting all the free advice YouTube has to offer, right? But if you want to get the secrets to success, that someone's going to have an intimate conversation with you, looking at your business plan, you know, looking at, you know, your systems, then you should pay to play.
Yeah. And I guess one last point I would say is, and this applies to all entrepreneurs, you must be self-aware. You have to be honest with yourself, what you do well and what you do poorly. And obviously focus on your strengths. Try to improve where you're weak. Of course, you should be improving yourself. but you absolutely should be hiring people who are rock stars in the areas that you're weak and that you recognize are meaningful to your organization. A lot of CEO founder types take pride in knowing and being able to do all of the things within their organization. Like, hey, I do billing, payroll, I do the coordination, I do the marketing too. And it's like, well, that is $18 an hour work. Are you proud of doing $18 an hour work when if you were working in another organization, might be making $75 an hour? Like, does that make sense to you? So it's like not having that self-awareness to say, hey, what's driving this behavior, or what am I not doing well? If you don't have that, then you end up doing the same thing over and over and over again, and being one of those people that's like, well, I'm not making it in home care because I didn't have enough money, or I didn't make it because it's a man's world and I'm a woman in this business, or you hear it all when people aren't being honest with themselves. So I think self-awareness is really something that matters and is critical for all entrepreneurs, especially in home health, because there's so many moving parts. Okay, so there are questions that are coming in from people who are viewing, and they're really good ones. So I just want to reiterate, just wait. We're going to get through the questions of the people who decided to join and be on the panel, right? They're putting their face out there. It's not necessarily the most comfortable thing. So we want to answer their questions, and then we'll start getting to some of the viewers' comments and questions, and hopefully that rounds things out, especially those that haven't been touched on just yet. And Cassandra, your third question, what would you say is, something that has you thinking?
We can go a little bit in depth and about the caregivers within the healthcare agency. Some people might be thinking, is it a great idea to have caregivers that live in with the elderly community or not live in? Like, what's the pros and the cons of that, having live-in caregivers?
Okay, so I would say the pros of having live-in caregivers is that those caregivers are there 24/7, right? In my organization, the live-in shift is a 13-hour shift, and it totals out to 91 hours a week. So what we do is we either have 3 caregivers in the home, right? Either working 39 hours, 39 and 113 to avoid overtime, or we split the difference and they work 46 and a half hours to get there, right? Or something like that. Yeah, it's somewhere around there, like 45, 46 hours they work. And then they get a little bit of exposure to overtime, and it's just 2 people managing the case. The good thing about that is there's less kind of BS when it comes to showing up late. My car broke down. They're at the home. Commuting is not necessarily an issue. A lot of times those live-in caregivers don't have to spend as much on housing expenses because they're half of the month they're living at the patient's home. So it ends up being kind of favorable for them. In New York, a live-in client is worth anywhere between $15,000 to $27,000 gross profits for our company, depending on the rate that we negotiate, right? So since it's a lot of hours and it's 7 days a week, you make money on live-ins. The con, in my opinion, is that those live-in clients tend to be higher need or higher level of services. They're going to be Hoyer lift, bed bound, or dementia clients that may not be sleeping at night, so it's really stressful to manage them. And also, if you're mismanaging your personnel in those live-in homes, you're going to run into a situation, and you may run into a situation with overtime and how the shift is being considered, right? So in theory, they're going to be on the clock for 13 hours a day. Those other 11 hours, they're not supposed to be working. So if they're getting interrupted at night and working throughout the night because it's a demented patient that doesn't sleep, then they should be compensated for that, right? So you may get yourself, and I was in these lawsuits, and these lawsuits were going around the United States where home care operators are being sued for not paying enough into the overtime, and when does overtime begin and end. So you need to have really good documentation around the sleep patterns of that client. And when it exceeds like more than 1 hour of interruption at night, then that needs to be adjusted and accounted for in a change of care plan, and maybe moving to 24-hour split services. So the pros are you can make a lot of money. It's fairly stable to staff. The cons are you might run into like FSLA issues where you may now find yourself on the receiving end of a lawsuit for higher staff in those cases. I was just a little side note. I was doing due diligence on a company that we were looking to acquire, that the way that they dealt with their live-ins was that they just made them 1099 employees. So overtime didn't count, which is totally immoral and illegal. So if like we can't move forward on buying that company, because at some point in time, there's going to be a lawsuit where those live-in aides are suing for retrograde pay for all of those hours that should have been overtime. Not even including the overnight stuff, but just, hey, I worked 7 days a week, 13 hours a day, and when I was getting paid a flat rate, I'm entitled to some overtime pay, and that could be a multi-million-dollar lawsuit. So when people shy away, and I guess maybe you've heard like, maybe you shouldn't want to take live-in cases, it's because of those administrative responsibilities that come with them, that if you don't manage it properly, you might find yourself on the receiving side of a lawsuit.
Now, I did not have live-ins in my agency, but I have heard from, other colleagues that, the live-in caregiver, I'll have to say he or she, like that's their sweet spot. They want to be a live-in. So I would say that's a pro, that you're going to have a group of people that's what they want to do. Then the con of that, and it's like I said, this only from what I heard, that they can be kind of territorial. So what if you need to go in and do a supervisory visit? Then it's like, oh, okay, well, she's asleep. They don't necessarily want you to see what they're doing, so then they kind of like guard the door, or be, kind of. Is that true, Karl?
No. They're more territorial with the other aides that are on the case.
Oh, the other aides. Okay. Yeah, and I've heard that too. I've heard, oh, you sent this aide here and she cleaned up the whole house, and now Miss So-and-so wants me to clean, so first-hand experience, but talking to some of my colleagues that have agencies, I said, oh wow, that's interesting. Yeah, we're going through it. They're mad at this aide because she cooks better. So now the client wants that aide to have more hours, so then, but
yeah.
I don't blame that aide. She's marketing herself.
Yeah, and that happens too. Like somebody goes on vacation, the replacement aide is better in the eyes, not even better necessarily, but in the eyes of the patient, and they lose their job for going on vacation, for taking days off, because the replacement was better than them, and those things happen. Yeah.
Yes, So, and you just mentioned vacation, and that's the last point that I feel like they can get a lot of burnout, because they are just there all the time. And how do you handle if they want to have company? Have you ever had like someone visit the patient?
Listen, we even had a patient, an aide who threw a party at the patient's house and was sharing the event on her social media. The patient like in her wheelchair, like, ew. These things happen. They'll have like boyfriends come over. It's not, you obviously discourage it, just like with a nanny. With nannies, they're not allowed to have, visitors and friends and boyfriends and that sort of thing. So it's more or less the same. It's their home. It's not your home. And that's why we split the shifts, right? Because they're there for 3 days. That's their, they work 3 days. They get their full 40-hour work week, and then they have the other days off. And those who work it, like, that's a good point that you made. Those who work live in shifts, they're live-in aides. They prefer that format. They typically aren't too concerned with children, or sometimes they're not married. They live alone, or they lived in a shared environment. Just being out of the house is just good for them. They prefer that. So right now we've had an issue with live-in aides because of all the kids being homeschooled. So some of the, and just aides in general, where a lot of the aides are women and their mothers. So caregiving kind of gets into the way of them working these jobs. Or, I have suspicions that my husband's cheating on me, sort of scenarios. So they don't want to be out the house at night, as if that's going to stop anything. But those are the sort of things that you run into with live-ins. So Cassandra, I know you have plenty of more questions, but it's time to kind of turn it over. Your questions are absolutely great, especially from the mindset of someone who's getting started. But now let's kind of turn it over to Eva, where Eva is now helping in the family business and really looking to take it to the next level. So her question is going to be more geared on those growth, I guess the growth of an agency that's now moved out of the startup stage.
Awesome. Yeah. So my first question for you both is, clients are always going to come and go, but what advice do you have for companies that are struggling to retain clients and for whatever reason, or retain clients for whatever reason? And then in addition to that, do you guys see commonalities amongst the people that you help in the consulting aspect of your role, and with the clients, the people that are losing clients more than they're growing clients?
Sean, you want to take this one first?
Sure. So one of the things that I implemented, the bulk of our clients were on Medicaid waiver, so we had to do a monthly supervisory visit. So we added a component to, just really have that supervisor even talk with the person, talk with the family, to find out if there was anything going on. I feel like if a person is talking, then you can know what's going on, and you can solve a problem. Going back to, we're always solving problems. So I think if you get so big and you're not organized, you stop talking to your patients and families, and you stop getting that information. And so that information needs to be communicated monthly. Then you have a meeting. If you're the administrator, you need to find out what's going on. And then, like you said, if it's a trend, if you start seeing, okay, we're dropping clients, then you should have caught that before, because somebody should have told you. We even had nurses that would say, "Oh, Miss Smith had another agency in here," So sometimes, if you got a good relationship with your nurses, and they want to keep their job, they're going to tell you, and they may not tell you as an administrator or the owner, but they're going to tell somebody, and you need to make sure that information is addressed, so you can go to the family and find out if there's something you can fix, because it's just like in marriage, it's cheaper to keep her, right? So you want to fix those problems. You don't want, it's cheaper to keep Miss Smith than to go out and try to market, for somebody else. But then you should always be marketing, because you got family, you got patients that expire, you got patients that go into the hospital, you got patients that if they're private pay, they may wean some of their hours. So you have to be thinking about all those things. But my main point is to communicate, develop some kind of communication. I also did like a newsletter where I communicated with the families. So they had multiple ways to get back to me or get back to the administrator at the time if they had a problem.
Yeah, and I totally agree with what Sean is saying. Retention, when it comes just to service, right? You're going to lose patients to death. You're going to lose them to hospitalization. You're going to lose them to not renewing their Medicaid status and losing their benefits, relocation. Those sort of things happen. But the service-related issues are really something that you have total control over, okay? And the only way that you are going to keep your customers satisfied is really listening to their request and doing something about it. When somebody calls in and says, I don't like my aide for X, Y, and Z reasons, and they're reasonable, right? Like she always shows up late, maybe gives attitude, always on her cell phone. You know, I actually don't know what her face looks like because she's always like this. You want to be able to take action, right? Because nobody wants to be, most people don't like to complain. And then if they do complain, they want their complaint to be heard and addressed. So if you start to see, like, first of all, if you're getting complaints, you should address them. Most states require your organization to have a clear complaint system for how complaints are addressed, where how they're addressed and logged and maintained, and do they make it into your quality assurance and quality improvement program, okay? And they also require that you have a QA, QI, or QA PI sort of quality assurance, quality improvement, or performance improvement policy, like system in place where there's regular meetings, et cetera. And those are all meant to capture the issues that are existing within your organization so you can scrub them out. Because if you have an issue with maybe the aides being underskilled for the type of work that they're being placed on, that's a common complaint. This aide doesn't know what she's doing, right? You can't put a new aide who's never worked with a Hoyer lift or a totally bedbound patient with no additional training to a total care client and expect people to be comfortable, because they're going to look concerned, they're going to be afraid, they're going to be nervous, there's going to be risk to the patient. That's going to create an issue for you, right? So if you see that's happening frequently within your organization, like, hey, this client has had 5 aides in the past month, right? High turnover, high utilization of aides. What's going on here? You should, like, that should be one of your red flags. How frequently is this person changing aides? Why are they changing aides this frequently? Like, and then what are you going to do to kind of offset that, whatever that common complaint is? Then you're going to want to look at all your complaints within your organization. How frequently are we getting complaints that people are late? How can we improve the timeliness of our aides and stress that? Is it driven by bonus? Is it driven by performance evaluations? What are we going to do about it? And once you identify what that trend is within your organization, you can implement some sort of solution, whatever you think is a solution. Track it again for the next quarter, see if the complaints have gone down, see if the patient satisfaction scores have gone up. So I think first you need to listen, and secondly, you need to have a systematic way of knowing that you're doing something to improve that patient experience and that you're actually able to objectively score it, right? Because if not, because you're like, oh, we're doing everything great. Once again, you're not being self-aware, you're not being honest with yourself. What does the data say? Are patients satisfied? Yes or no? If patients are complaining, when you make a change, are they satisfied with the change? Yes or no? Because they're going to typically give you a few different chances to get things right before they say, hey, you know what? I'm going to test the water with somebody completely new. Just like it's cheaper to keep her, it's also more comfortable for the patient to stay in the system that they're in rather than testing the waters with a new agency. They don't know what they're going to get from that agency. It may be worse. So you usually have multiple opportunities to resolve the problems that are going to result in loss of clients. In addition to that, I would say if you see that you're losing patients a number of patients due to them not renewing or refreshing their Medicaid or their status to receive their benefits, you're going to need to know, well, what is the cost of losing that patient? And does it make sense to have an employee within the organization that all they do is Medicaid recredentialing? If you're losing 20 patients a month and you're using the same analogy that I had before, that a patient's worth, $15,000 and you're losing 20 a month, that's $300,000 a year loss. You could hire a Medicaid specialist for $50,000 a year, and their job is specifically to manage and help people renew their Medicaid, because it's going to at least conserve $250,000 of profits rather than you losing it all. So if you have to be systematic in reviewing what the problem is, and then testing solutions for that until those problems are greatly reduced or eliminated from the organization.
Wow, thank you. That was really valuable insight from both of you guys there. But I really like what both of you guys touched on just, looking at patterns and kind of just checking your stuff as well on the other end. Awesome. So I want to
and real quick, don't, as a non-nurse, a non-clinical person, don't be intimidated when you're asking questions that are clinical. They're giving you that information, and if it might be something they don't want to fix, but like Karl said, if it's going to keep that client in place, then you always want to be looking at that and fixing that problem.
I wanted to kind of move to the other side and talk about something that you touched on earlier, Karl, in terms of marketing. So when you're trying to grow your business and gain new clients, what do you guys think is the best strategy in terms of marketing? Is that having a strong social media presence, or is that going out and meeting people face to face? Is that calling people and emailing them? Can you guys talk a little bit about that?
Sure.
Okay.
I talk a lot, so I don't want to hog the airtime.
No. So Karl mentioned this before when I think one of his lives. I definitely feel like you need to have a strong social media presence, because people don't go to websites anymore, right? But people are on Facebook all the time. People are on Instagram all the time. People are on the other social media platforms all the time. And so you need to be there, and your business needs to be there. And, you need to have relevant content for your home care agency. And I think we need to work on what that looks like, because some home care agencies aren't doing it right. They're posting once a month. Sometimes, they haven't posted in 6 months, and they're wondering why they haven't gotten any clients from Instagram or from Facebook. Well, I definitely feel like having a strong social media presence is there. But your main source of marketing is going to be getting in front of people. But you should have that social media, those social media platforms in the background, because I feel like that is there when you're sleeping. When somebody's up at night and they're, angry, searching online, then your Google ad can come up, your social media, your blog, your social media posts can come up, and so that is resources. That is your page while you're sleeping. But your main activity should be constantly trying to get in front of someone that's a decision maker, whether it's a family member that's, wants, help from mom and dad, or your case managers or other referral sources.
Yeah. I agree with everything that Sean has said. She's right in those regards. Your social media is going to be in the background. That's gonna just because you are a listed licensed agency in your state on some sort of directory, you'll get a few leads from that. You'll get a few leads from social media. But the greatest driver of business is going to be the relationships that you establish with high probability, high volume referrers. Meaning you need to, let's just say in our business, right, we're in New York, we're pretty much 100% managed long-term care. So some states Medicaid waiver, whatever you want to call it. In New York State, it's managed long-term care, Medicaid managed long-term care. It's important for us to have rock solid relationships with the case managers in the intermediaries that are managing these lives. Just like a staffing coordinator in home healthcare has a responsibility of making sure an aide shows up to that patient's home, the case managers within that organization have a responsibility to make sure that all their clients are getting some sort of home care services. So if they're on the receiving end of, hey, I haven't had an aide in 3 days, the agency hasn't sent anybody here, what's going on? You want to position yourself as the number one phone call for that case manager or that coordinator to resolve that problem. They're going to have that situation daily, right? They might be managing 200, 300 lives. So every single day, they're going to have somebody making a request for a change of vendor, making a request, for an agency, or they're going to even be assigned unattached cases that need to be placed with somebody. They're going to place it with the person that's going to give them the most help, feedback, support in the way that they like it, right? It's not necessarily like your style of support is their preferred style. But once you establish the relationship with someone like that, they're going to be high volume. They're going to be routing you patients. Again, if you're in the skilled world or still in the personal care world, physicians, social workers in hospitals, social workers in skilled nursing facilities, these are all people who every single day are in contact with patients who have home care needs. You want to be the agency that comes into their mind when they identify that need, right? That's more important than whatever random Google ad that you're putting out. Because when that person is pumping you 50, 60 patients a year or more, because you always answer the phone, they like the way you look, they like the way you smell, they like the fact that you bring snacks to the office, whatever it is, that's going to be your bread and butter more so than any other marketing tactic or strategy. That face-to-face relationship pays dividends more so than anything else. So that's what you have to think of. And like one important thing when you're making this face-to-face contact, you have to ask them what is important to them as the referrer. Do they value the output, like your performance, right? What are the trends? Like how frequently are patients being readmitted to hospitals? What is your infection rates? There's going to be people who are more data driven. There are going to be people who want to work with you because you're polite. There's going to be people who want to work with you because you're prompt and you communicate well. You always answer the phone and you always get back to them, right? That's usually by the way, that's the majority, right? You're prompt, you get back to them. They know where things are. The communication is rock solid. So that is so much more valuable than any other form of marketing there is. That even if you pick up a good rep from another organization, you want to know what are their relationships like, right? That's what when you hire a marketing rep, that's what you're looking for, is how plugged in they were, and can they prove their referral flow? What are their relationships like? Because that's what's portable. Establishing those relationships may take years. So I would say, have a social media presence just so if people see a flyer and they want a little more information, they can get it. But that's not what's going to convert. The doctor saying, I want you to go to this home care agency holds so much more weight than your 4.9 star review on Google. Patients listen to the doctor, good or bad. So it's more important to kind of like have the relationship with the trusted person more so than the optics of your organization.
That's great. Thank you so much. And then I have another question, or we can, you tell me if you want me.
No, for me, I
know
could go on for some time.
You tell me.
Yeah, no, actually, Sean, I know that you have some time constraints.
I'm good for 8:30. I've extended my help.
That's your hard stop. Okay, I'm gonna go on to answer your three, and then to go on to the question. So, don't feel guilty about asking.
Perfect. Sounds good. Okay, so my next question is in terms of structure. As we've already said, the company that I'm in is established. But when you talk about what the framework of a really established company looks like, can you touch on a little bit of, it's kind of a two-part question, what the structure of an established company should look like? And then when you get more to the day-to-day in terms of the person that is scheduling the aides and the clients, or the HR person that's hiring and bringing in the aides, and then the third part, the marketing person, again, this is maybe handling social media and all of that stuff. Which of those roles are the most important, do you think, for a business that's trying to build a stronger foundation and grow beyond just the one-man band, family-owned or family-operated type company?
That's an interesting question because for me, my agency was skilled, so I didn't have any aides. So my first thought is, if I needed to, a receptionist or office assistant can post an ad on Indeed. I just need the DON or the RN supervisor to do the interview. I don't necessarily need an HR person doing the interview. If I'm in a tight spot and I'm trying to grow, and I have a limited amount of staff, then I might do one of those outsourced HR people. When I have that HR person in the office, I might outsource them to maybe post, but I also may be looking for someone who I can use as an office assistant / HR assistant to do some phone interviews, stuff like that. But for us, it was a weird part of the regulation that for Maryland that a nurse had to interview a nurse. So that's why I said it was kind of tricky for me answering that. So that's why I would eliminate, HR if I had to. So framework, the workflow, what is most important? You need clients, otherwise everybody else doesn't have a job. They don't have anything to do. So so your marketing person, it's pretty important after your administrator, then after that, your clinical person and your scheduler. Like I said, maybe I would have like the scheduler do some additional duties. If you're just getting started out, that's how I would maneuver it. The workflow for like a business that's trying to grow, I would just really probably encourage them to outsource some of these things. Maybe somebody can work from home that's a scheduler. You have some answering services that can also do some scheduling, stuff like that. Come back to me. I kind of got foggy on that question. Can you pick up?
Sure. It's okay. All right. So the structured question is kind of hard because it's all relative to kind of where do you see yourself at some point in the future, and like what sort of agency you want to be, right? So like 100 client agency is structured very differently than a 10,000 client agency, right? But I know what phase you're in based upon what you're saying. You're moving from family to a little larger. I think you have to look at first the people who are in the organization currently. Truly identify their strengths and weaknesses, and are they satisfying any of the roles that are required, like that you mentioned, marketing, HR, coordination. Are they like rock stars in any of those areas? And is that truly their strength, right? And is that what they love and whatever? Because if they love it and they're strong at it, then that should be their home until they reach their capacity, right? And then once you've like assessed that core team as to what they're capable of, where their heart is, where they're strong, where they're weak, then you can start looking at who else you bring in. Now, the issue with healthcare staffing, home healthcare, is the same chicken egg problem. You need patients to make money, and you need caregivers to service those patients. You can't keep caregivers if you have no patients. And if you have too many patients and no caregivers, then you hurt your reputation, because then you can't service those clients. So in my opinion, you should have a recruiter and a growth person working closely together if you're looking to grow. Coordinators are important from a standpoint of the day-to-day, like they're really important because they're the day-to-day contact. They probably have the most contact with the client. So it's important that they communicate well, they understand the systems within the organization, they're good people, they're responsible, they're organized. But you're not going to grow your business on a coordinator. You're going to grow your business with the marketing person and your HR team, or your recruiters, more specifically, who's bringing the workers into the system, right? Either whether they're outsourcing and using staffing agencies to fill roles, or they are out there and marketing and bringing in employees to work. They have to be like, this is something that we're currently working on within our organization, is having better communication between the growth team and human resources and recruitment. Because the growth team needs to be able to advise human resources where they're seeing growth, where they're having trouble covering cases, what sort of aides or what sort of personnel do they need, and that recruiter has to keep adjusting their recruitment strategies to satisfy this upcoming demand. In long-term care, we are fortunate to have some lead time. If we are recruiting our own patients from the community, that's a 15 to 60-day cycle from the time that we initiate the referral to the time that they start services. So if we know that we have 10 clients in the pipeline, 3 in Queens, 7 in Nassau County, the recruiter needs to know that as soon as possible so that they can adjust to recruit the necessary workforce for those clients. Well, what are the projected hours going to be? What neighborhoods are they in? What languages do they speak? Is there some sort of gender or ethnic specifics that are required to be able to stabilize this case? And they need to be working together. So I would probably, from a growth perspective, after you've like really cleared up all kind of like workflow and procedural stuff, the next thing would be building this growth team that's going to be a combination of recruiters and business development people. You want to call them marketing reps, sales reps, whatever they're going to be. Sometimes we employ social workers within our organization that understand what case management really is, and they have the touch, they know how to interact with clients more so than some dude who's just a sales rep or a marketing rep. Their heart may not even be in it. The social worker's heart is in it because they took on that profession to help people make informed decisions and get the care and support that they're looking for. And they know how the systems maneuver, and they have friends who are working in other systems. So I prefer to have social workers in my marketing roles or nurses in those marketing roles than the classic marketing rep, because that classic marketing rep usually is crap. Usually, some of them are strong, most of them are terrible. People who have a license behind them, people who are lifelongers in healthcare who kind of know the moving parts are going to be better for you. But if you're structuring yourself, that's kind of that is going to allow you to grow your business and afford to pump money back into it. Because once you have money, you're going to be able to attract better and better talent and more growth centered personnel.
Thank you. That was super helpful. I mean, I told you guys, everyone watching, they're going to be dropping gems. So that was great. Thank you.
Cool. All right. So now I'm going to go into like the questions that are coming across the board. Hopefully these people are still here. If not, they're going to come back in and give me some ad rev when they see the question is being answered. All right. First question. What are practical ways to perform your market research and analyze it in terms of competition and clients? Okay. Your market research. First, I would say is identify what you think your market niche is going to be. What sort of service provider are you going to be? Are you going to be pediatrics like Sean? Are you going to be exclusively managed long-term care like we are in New York? Are you going to be skilled? Are you going to be skilled and only focused on wounds, or focused on PT, or focused on speech? So I think you first need to know what your niche is going to be, because that's what you think you're going to be proficient in, right? Not so much so because the market data has revealed that that's where the gap is. That might be your approach if you're just filling the gap. But usually you're going to want to say, well, what is my strength and what is my area of focus? And what are we doing differently, right? So you identify your niche. After you identify your niche, then you're going to want to get a sense of really how many people are in your target market. Like, what is the volume of people who may fall into your service need, right? I look at markets that are robust, over 500,000 people in the city or town or what have you. There's going to be enough people there to service. After you've done that, when you look at competition, you're going to really want to compare apples to apples, right? So when you're looking at competition, you want to make sure that you're looking at skilled agencies versus non-skilled, and then how many agencies are in your niche. And is the volume of patients per your city sensible enough that there's enough? Typically, there's too little healthcare providers in the country, right? I've never heard of an area that's saturated with healthcare providers, right? There's a lot of home healthcare agencies. There's a lot of competition. There really isn't, because most of them are not good. So I've never heard of there's too many home care agencies to satisfy the market need. So you could get that out of your head. But really, you want to make sure that there's enough business for your particular niche in your city. And if you're going to be analyzing or kind of weighing yourself against the competition, then you really want to come up with things that are objectively differentiators between you and them, something that you can measure. Otherwise, it's just going to be like, well, we're the beta agency because we care more. Like, what does that mean? Right? That's such a subjective position. You're the better agency because your hospital readmission rates are this low, your infection rates are this percentage compared to your competitors, right? If that's going to be the differentiator. If your differentiator is going to be availability, right? We have the most nurses, right? So, when you call us to fill in a skilled nursing assignment, we have nurses. We're not going to tell you, oh, I'm sorry, we can't accept this case because we just don't have the personnel. So it's kind of hard. That's a hard question to kind of give a simple answer to, because marketing has so many moving parts. But whatever you do from a marketing perspective, make sure your data is truly objective, and you're able to look at it and make decisions based on that objective data, and that you're collecting objective data.
And just to add, I like how you said, basically you definitely need to know your niche, and then something you can add to your market research after you figure out your niche is, and this may make you feel more confident after you've said, okay, I want to focus on these seniors. There's a hospital here in Washington, D.C. area, and they said all the stroke patients there. Well, maybe you should look up how many people had a stroke in the past 3 years. Then, you may say to yourself, oh, I can service these people may need this kind of help. And so you have to look at it like that. Like, okay, now I have the older population, or I have somebody that may be from 40 to 60 that had a stroke. They may need personal care. They may kind of help. So then that's how you break down the different kind of people that you would end up servicing with your agency.
And then you also need to know where those people, like the niche that you're going to service, where are they? Right? Well, like, all right, I'm in this city, I'm in Atlanta, I'm servicing Medicaid clients. Where are Medicaid clients? Most likely in low-income neighborhoods. That's where that's where I need to concentrate my efforts, right? That's where the fish are. So, you need to know that if it's physical therapy for total joint replacements, then you need to be talking to orthopedic surgeons, and you need to be going to the hospital for special surgery if there's one in your city that focuses on orthopedic surgeries. Right? They're going to have that's their niche. So you obviously want to align yourself with them. The next question is related to money, which I don't think we brought up from either of you. So one question is how to raise money and when to hire in relation to when you open your doors. And the second bit is a question about what does it mean to be well capitalized? How much capital for a successful startup? I personally preach to be well capitalized to start with. When we started our home care agency, my mom and I, we weren't. And there's obvious growing pains involved there, right? You're gonna sometimes have to turn down business because of the gap between when you provide services and when you're reimbursed, because you just don't have enough cash to float payroll that long. I mean, that's an awful scenario to be in. Like there's business there waiting for me, but I just can't service it because I can't afford to carry the payroll out a month. It's embarrassing. I mean, and it's horrible, actually. Like there's companies that you could factor your receivables, you could try to get advances on your claims, but when you're just getting started out, you don't have proof of you're just in a bad place. So if you're undercapitalized, your growth is going to be limited to how much money you have. As far as how much money do I think you need, that's kind of a tricky question because it's going to vary from state to state. For example, in Florida, in starting my Medicare agency here, they required that we had I'm just going to say $100,000 of cash reserves just for Medicare clients, locked up, just cash reserves, plus the cost to start. So that's carrying my office space, having employees on staff, my consulting fees, software cost, just all of these costs as I'm servicing clients for free until I hit the thresholds to now have the necessary accreditation surveys that get me Medicare credentialed. So in that startup, I was above the $200,000 range to get started. And that was because I'm not a nurse. I hired a director of nursing full-time so that they're committed to the organization. So they've hired full-time with an equity stake in the company, looking to make sure that our nursing department is running rock solid, and it is, right? But if you're a founder and you're a nurse, then you're going to obviously occupy that seat, and maybe you're not going to pay yourself. And then if you have a partner who's going to function as an administrator and they're not going to pay themselves, you might need to just pay one helping hand in the beginning. Who knows? Or maybe you have your physical therapist or your other therapies on contract getting paid per visit. In Pennsylvania, I have a friend who I think his requirement was only like 20,000 or 25,000 for Medicare. So the Medicare requirement is going to vary from state to state. That's number one. And then the second thing is when you're starting out, what kind of organization do you want to be? Do you want to be an organization that says, all right, from day one, I have $1 million budget. I'm hiring 7 marketing reps at $75,000 a piece. That's going to cost me, roughly $500,000. My nurse is going to cost me $120,000. My administrator is going to cost me what they cost me. And then I have the other $250,000 for payroll, float, and whatever. And that's how I'm starting. Right? That I guarantee you that agency probably hits $1 million in rev in 4 or 5 months, 3 million in the next 6 to 9, 5 million, and then by the end of that 1-year term, they might be at a 12-month run rate of netting $1 million a year because they put $1 million in from the beginning. The agency that puts in $15,000, whatever the minimum was, they might make $15,000 for the first year, right? Because they just don't have enough to even work with, and they're still working their full-time job to make ends meet. So it really depends on what kind of organization you're going to be. Again, you could even look at it and say, hey, I'm going to start out with $5 million, right? And that's possible. And the type of organization you're going to build on a $5 million budget is going to be completely different than on a $25,000 budget. So I always kind of say, look at, your initial cost being well over $100,000, just so you have good footing, like enough to that when you're growing, the numbers that are coming in make sense for you to stay motivated and to see some progress. Making an extra $2,000 a month or billing $3,000, paying out $2,200. I mean, I don't know who's in this business to make $800, right? So that's not going to be that exciting to you from the beginning. And there is a fairly low barrier to entry cost-wise, but you're gonna be stifled by that.
Real quick, Karl, I'm gonna ask you a question because I feel like they're making so many changes in different states for people to get licensed that it'll be hard for them to get licensed. They're making it harder for people to get, just like how you said was happening in New York. So should someone take advantage of, well, I have enough right now to get licensed. I may not have enough to start accepting clients. Should they just take advantage of that part of getting started?
Yes. So yeah, they should, because if they could do the bare minimum to get their license, get the license. Because in New York, when we got our license, we actually got our license in 2001 and didn't provide services till 2010. And the reason we started providing services was because, like, our phone started ringing with people offering to buy our license, and went from 10,000 to 50 to 100 to 200,000 to buy the license. And I was like, wait a second, what's going on? They had placed a moratorium on issuing new licenses. Like right now in New York, there are no new licenses being issued. So if you want in, you need to go and buy one from a dormant home health care agency that might have only spent $20,000 to get started. And now they could command $175 or $200K for it. So there may be some value there. Also, I know somebody who only gets licenses and sells them. My landlord one of my landlords in New York, that's his business. He starts DMEs, home care agencies, and proprietary schools, fully loaded, sells you a turnkey business. Now you go run it. You don't have to deal with the administration portion. Just go run the business. It's not a franchise, it's yours, but I did all the legwork. And that's been his business for the past 15 years. He actually called me to try to buy my license so that he could turn around and flip it, because he knew that he couldn't get, that was his line of business. I can't get new licenses. I'm going to try calling on these dormants and seeing what I could do and kind of broker some sales. So I would say yes, short answer, yes, you should do that. But also really, if you're getting started, talk to people who are experienced. I think most people will tell you, the early days with no money were hard. And as you make money, it makes it easier to make financial decisions that are going to benefit your business.
Yeah,
So,
I agree. I would encourage someone to not feel overwhelmed by hearing, I need $100,000 to get started or $25,000 to get started if you don't have it. I totally agree with Karl. I think you should go through the process of getting the license. Karl has a training coming out for starting a staffing agency. Do that too. Use the money from your staffing agency to plug into your the home care business. So think like that. I just really feel compelled that somebody just heard that number. They were like, oh, like throw up paper and just to let you know, this is still a good industry for you. You can still get started. You might just have to shift some things. You might have to do it a different way. And so still go for it. Some states, the license fee is $500. Some states it's $2,000. Get it done. It's not
in
like
Michigan, there's no license.
And you said Michigan?
Yeah.
I think I heard Michigan and Mississippi is no license. Go ahead and get that license. Get yourself approved. It's not like it for the states that make you go through the credentialing process. It doesn't happen overnight. So you need to start now. Stop dragging your feet. Start now. Get yourself licensed. And I don't want to say worry about that later. Like Karl put his email. He said email me. He has a course starting for the staffing agency. It's a low cost startup. Lower cost startup, and you need to learn how to use another business to fund your main squeeze, right? Your main squeeze. So that's my suggestion.
Cool. I'm gonna try to get one more question while I still have you for 3 minutes. That's not a good one. Okay, here's one that I think is kind of interesting. How many caregivers should one hire to begin with?
You want me to answer?
Yeah.
I think you should hire close to 10. I would say 10 is a good number. My reason is you have all these assortments for shifts for home care, right? It's not a 9 to 5. It's not a 3 to 10. People that work in a nursing home. It's funny because I had someone complete an application. What's your availability? 3 to 10. No, you're not working in a nursing home. So, my first thought is, 10 people, 10 nurses or CNAs or aides that have various hours. You might get someone that they're only available every other weekend, and then you get a client and they need every weekend. So you want to be able to fill multiple shifts, a day shift, a night shift, a 12-hour shift, a weekend shift. So I think you should be looking for someone that can, for personnel that can fill multiple home care shifts. So that's my suggestion. What would you say, Karl?
Yeah, I would say just hire continuously, without really how many, right? Like I would just consistently hire people and tell them from the beginning that you're just getting started. Hey, I'm just getting started. I'm looking for quality. Can I count on you if I need you to work this kind of shift? What sort of shift will you be available for? What frequency? And if you do find another job, can you call me? Can I keep in touch with you to let you know what is going on with the organization? Be candid in that regards, because people, believe it or not, kind of buy into your story. Like they'll buy into like, okay, you're new, and people who really want to help you are going to ride with you. So I would just say continuously hire people. From a personal care perspective, I would say hire 4 aides for every one client that you plan on servicing. Um, that's just kind of my rule of thumb, because you kind of go through about 3 or 4 phone calls to find the right match. So yeah, that would be that. From a skilled standpoint, fortunately with skilled, there's a lot of agencies that you could work with that could help kind of dispatch per visit. And you're paying per visit. It's mostly per visit work on the skilled side. So you don't need like the one-to-one ratios like you do on personal care. So you could kind of stretch further. Like we have like 30 visit rule per week for a full-time nurse within our organization. Their expectation is to hit 30 visits in a week period, right? So if they're going to be onboarded full-time, we need to know that we have 30 visits for them. Or if not, then we're going to pull people in on a per visit basis. So we'll have a pool of nurses and agencies that we contract with that do per visit. And then once we see that we're reaching a certain threshold of average census, then we know that we have, one nurse available for whatever that average census of 30 is going to be, or the equivalent of 30 visit units. An initial assessment counts as 2 units versus a single visit that might just be, a dressing change. So each visit kind of counts that way.
Great answer. Continuously hire. And do you have any suggestions for people? I saw a question about onboarding process. I think, keeping that caregiver, that nurse, interested is pretty essential. How does your onboarding process work? Do you consider that it's long? Have you been told it's long, or do you guys, get through it pretty quickly?
It's long.
Yeah, I was gonna say it's genuinely long getting the stuff back, and that's what is a challenge sometimes for putting a caregiver or a nurse on the schedule.
Yeah, onboarding and employee compliance in home healthcare and healthcare in general is quite involved, right? Because it's their credentials, their continued education, their health status, all their legal documents, and the mandatory in-services and orientations that you need to have, and sign-offs and all that crap. So yeah, you need to be continuous, because you may have 40 applicants and like 36 of them are incomplete. and now the job is getting them to the completed phase. And agency nurses who are working in multiple home care agencies, or who have been working in that industry long enough, they're easier to hire because they already have their profile or that packet together. They know what is requested of them. So they just have it sitting in their shelf or in their desk. And when they're shopping themselves around for new jobs, they know the faster they could get a completed file to you, the faster they could be part of the workforce. So you'll see that too. But onboarding is also one of those things that's state and reg specific. But in most states, it's virtually the same. That person needs to be healthy, needs to be, not on any of the Inspector General fraud list. They no violent history or theft or anything that's going to be any legal issues that are going to pose a threat to the patient. Their medical has to be in good shape. All the immunizations need to be there. It's the same sort of stuff, but it's a lot. And then your onboarding process itself, like this happened in my organization where people were being onboarded and staffed at the same time with the like, oh, we'll get it, we'll catch up on it. This is kind of a plague in all home care agencies because you have the case being offered today and you have this person who's qualified to work today, but they might be missing their, I don't know, employment authorization card, right, for the immigrants, right? And you're like, yeah, they have it. You put them to work, and now they're out of compliance, and they're working full time. To get them back in to hand off this piece of paper is going to become more and more difficult. Something goes wrong, you're on the hook. If the state walks in and looks at that file, you're in trouble. But people get into the habit of doing that, and then they may even grow their agency to a point where there's multiple people who have some sort of out of compliance packet, and playing the catch-up game interferes with growing the business. So I think it's always better to just function by the book on a good foundation, because I guess it's the last analogy I'll give, but if you build a house on a crappy foundation, the house is going to start to buckle, right? To correct that is going to cost you more than building the foundation right to begin with, right? It's going to be more involved. They're going to have to jack it up. They're going to have to re-pour concrete. You're probably going to get violations. People can't live there. You won't be able to collect rent. All these things will be an issue for you. So it's kind of better to just do it right from the beginning than try to run your business and correct it at the same time in the future. It's really complicated to do it that way.
Yeah, I agree. And we had that happen too. And like you said, trying to get the nurse or caregiver back in, and you already got them on a case, and you got to explain to that client why they can't work. So then the client becomes involved. Well, why can't they come to work today? Well, they got to come in the office. And then, it just becomes really messy. So, because then you don't ever want the client to get involved in, something that you messed up on. And just one thing for anybody that's watching, I don't know if it's like that for other states, but I definitely know in Maryland, if you're providing services to children, they want you to do an extra step. You can't just hire a nurse or an aide out of school. That person has to have at least
1 year.
1 year of clinical experience. And it's funny because we had some people put down that they work in a daycare, that, they have children, and they were trying to put that was their pediatric experience. And then, they definitely want you to match, if that child has a G-tube, they want to know that they've taken care of a G-tube patient before. So like Karl is saying, you have to, you don't have any other time to get those skills assessments and that information other than when they come into the office. And that orientation tends to be really long. How long is your orientation for your company when they finally come into the office?
About a full day.
It's a full day, guys. It's a full day. I call it the main event. The full day. Yeah, we used to call it the main event. And then for the person that asked the training course, we had videos that would prep that person before They came into the office. Okay, this is a reminder video of all the credentials. This is a video for, you know, this particular part of the orientation. And then we also set it up like Monopoly. So if they didn't pass their skills assessment, they didn't pass go. So then they were dismissed. And the nurses were really surprised, like, because the other agencies didn't do that. So they were dismissed, and they had to wait at least a month to reapply. Did you guys have a test for them to take too?
Yeah. We remediate in the
Yeah.
test. Yeah.
Yeah.
So like for us, it's if they don't pass the test, then they have to go through remediation with the director of nursing to kind of clear up whatever points are there.
Mhm.
Just because it's more important for us to get the body in the seat,
Yeah.
which is unfortunate. But you know, you start getting like to this point where I need the workers,
Mhm.
right? So
Yeah, and that's a good step that you have to deal with, because some people are just not good test takers, and you need to know your workforce. That is not that they're not good; they're just not good test takers.
Yeah. I'm gonna kick over one more question here. This one is for me. But do you recommend outsourcing billing services? So yes, I do recommend outsourcing billing services. I provide billing services for the users of our software, On Time ITS. So we have that software available for personal care agencies, social adult daycares, and staffing firms. And then we have personnel that if you want to add on concierge billing, our staff does concierge billing for you. I included my email or the email to the billing person within the organization. So if you're interested, just reach out to them. But as a side note, I started in skilled home healthcare in Florida last year, started providing our skilled services, like paid skilled services this year. And we're using a billing company because Medicare billing is new to me. So I'm not going to risk, trial by fire on my money. So I'd rather outsource it to a reputable billing company that understands Medicare billing, especially now that the billing has changed to kind of a PDGM model versus a fee-for-service model. I'm not risking messing that up and messing up my money. So I'd rather have a reputable billing company take a few percentage points off the top to ensure that 97% of my money shows up instead of 0%. Until we have that figured out. So I do recommend outsourcing billing because you're only going to be paying on what you're billing and you're making money. So you could the amount that you're going to get charged is going to be a fraction of what you're billing. And when you're comparing having a full-time biller on staff, especially early on, it's never going to make sense to pay somebody even a weekly salary or like whatever your like a per diem salary to do your billing. It's probably going to be cheaper to always go with the outsource route, just because it's going to cost you more. When you get to a large enough volume where it makes more sense based on the percentage points that you're losing to have an internal billing process, then you could kind of bring your billers in-house, or learn if you're a billing and coding professional prior to starting your agency and that's your skill set and that's where you're strong, then do the billing yourself because it's going to be something that you can do. But other than that, outsource. And if you need that help, let me know. But I think that rounds it out for this session, at least with Sean being present. I don't want to hold her hostage here on the channel. I do see a couple more questions that I am going to answer. So if you want to kind of say goodbye to the folks and tend to life, now's your time.
Bye, guys. I have 2 under 3, so I am a mom and duty calls, but this has been fun. And thank you, ladies, for, like Karl said, for sitting in the hot seat. I hope that, Cassandra, you get started, and you don't let anything hold you back from getting started. This is one of those things you just got to do. You can't keep sitting on the toilet. You gotta You gotta let it flow, right?
Yep.
And Eva, I hope that your family listens to you with all of the advice that you go back and share with them, and just take charge and growing the family legacy and taking it to the next level. And for everybody who has been watching Karl or is on the channel, take these, take notes, go back and watch the video from the beginning. Sometimes you need to do that to let the information soak in a different way. And hopefully you'll get started or grow your business this year, because I really feel like there are a lot of clients out there that, would love to have your agency serve them. So take care and bye, guys.
Bye.
Yeah.
Take care.
Okay, thanks for joining us.
Thank you, guys.
Instagram as Savvy Business Chick right here. Okay, bye.
Cool. Oh, cool. So now it's just us two. Oh, I'm alone now. Perfect. So I will continue with the rest of the questions that haven't gone answered before I sign out. So let's see. It's Marie. I am in the startup phase and currently working on my checklist for licensure. I work in healthcare and my biggest concern is staffing. How do you recruit good quality caregivers? First thing is you need to define what is good and quality to you. Based on, when you're starting an organization, and I have a video on this, you need to establish your mission, your vision, and your core values for your company. And those core values for your company should mirror truly what you're looking for out of your employees. So what's going to make a good employee is going to be, do they satisfy those core values that you have? So once you have that defined, when you're interviewing and you're asking questions, you need them to give you really rich answers that exemplify that they are that person that shares the same value sets as you. If being timely really matters to you, then you're going to need to really test for timeliness. Do they arrive early to the interview? How are they prepared? Do they arrive early to their shifts? Are they consistently on time with do they deliver things in the timely fashion that they say that they're going to deliver it? And that's going to all be telling if they're timely and if that's what you value. So you need to know those things. And when you're recruiting what you perceive to be good, right? You need to be able to test for what that good actually is. And then, as far as tools to recruit, I would say Indeed and LinkedIn, as well as Facebook, are going to be the best places. Indeed is probably the most trafficked online job board. And then Facebook is good for social media promotion and people who may just be looking. You could kind of find people that way. And then LinkedIn, you could do some like reverse prospecting. So that's how I would say go about finding the right staff. How many caregivers? I think we answered this one. Questions. Okay, Dev. What's up, Dev? What about Google Adwords and SEO? So, Google AdWords is gonna be a hit or miss. AdWords have become more and more expensive, and you can burn through a budget quickly by having an unfocused ad campaign. So you want to make sure that you're advertising to the relevant keywords and search phrases for people who are really looking for your product or service. And then you need to do some data analysis to determine, what is that customer worth to you? So in the example that I gave you, if one life is worth $15,000 to my organization, how much am I willing to spend in Google Ads to convert one client, right? Am I willing to spend $10 per click? Does it take 150 clicks to get one customer? If so, and I'm paying $1,500 for my $15,000 client, then I'm seeing a 10-time multiple on my spend. Then that may make sense. So you need to know, one, what is your customer worth to you, or what is your product when sold? What's the bottom line for you? And as long as your ad campaign is going to cost you some factor less than the value of the thing that you're selling, then you should be in good shape. But what I see happen with a lot of people who are putting together ads, they end up getting like a lot of BS clicks and not really what they're looking for, right? Like, you put out an ad for home care services and you'll get people clicking, looking for housekeeping, or you get somebody who clicks. It's an ad for looking for home care services, but you're getting clicks for people looking for jobs. And maybe that doesn't convert the way that you want to, right? Maybe you put a higher value on a patient than a worker. So that's one thing. Search engine optimization obviously is something that you should be working on just for more and more web visibility. That way you're ranking high enough to be discovered on Google or on whatever platform you're optimizing for, because that's going to give you some of that organic sort of free traffic rather than paid per click. So let's just say you post a Google ad, and you're paying $1,000 a week, right? And your ad is showing up first for people who are searching for home care agencies in Sacramento. But you've optimized your website well enough to be when people search home care agency Sacramento, you end up first under the ads, because obviously the ads would always be above you, right? And most people click the first 3 links. So it's usually the ads that they're clicking. But let's just say they're like, hey man, I don't want to look at, these advertisements. I want to find a real company, which I do. I just scroll past the ads because it's usually not what I want anyway. If you're then in the top 3, instead of paying $10 or $15 for that click, you paid 0. And you're getting the same sort of throughput. Maybe it's 1 out of every 100 clicks produces a client for you. Search engine optimization comes in handy at that point, right? Where you're now bypassing having to spend money for ads, because you've dominated a certain corner of the internet, so to speak. It's Marie's last question. Is it possible for one person to act as the administrator and RN supervisors to start up? If that person is qualified for both roles, it depends on your state. Some states will allow it, that you would be the RN and administrator. Some states don't. Some want it 1 and 1. Some states will allow 1 administrator, 1 RN, and alternates are required. Like in Florida, you need to have 1 RN, 1 alternate. So, yeah. Nehemiah Harris asks, so there's a gap in time between securing a client and actually starting services. If that's the case, then you should chronologically prioritize securing the client first. Yes and no, because it depends on your state again. So let's just say you're in New York, where you're taking somebody from the community who is just getting registered to Medicaid, then into a long-term care plan, then serviced by you. That might take, like I said, 45, 60, sometimes 90, 120 days. So if your strategy to acquire clients is that identifying people in the community who need the services, helping them register for it and whatever, then yes, you could start that process knowing that there's going to be a time lag, and knowing that, oh, I have this client in this particular neighborhood, they're locked and loaded, they're going to start in 20 days and 30 days. Now you have 20 or 30 days to play catch up and find a caregiver. In the skilled world, and even if they're coming already from the system, it may be, hey, I have this open case tomorrow. I have this patient being discharged today, needs services to start tomorrow. Can you take it? Then you need to have people on your roster ready to work, right? So it's not so direct as you're presenting. But in the example that you're giving, yes, you can kind of focus on pulling that in and then having a time lag, but that's not the only way that you're going to get a new client. What are the barriers to entry aside from startup capital and licensing? Those are your barriers. I can't, maybe if you have, a criminal background, can't enter. But that's going to be related to your licensing. So the barriers are startup capital and licensing. Those are the barriers to entry, actually. And then the next thing is just understanding the industry, really being knowledgeable of healthcare and home healthcare or healthcare staffing. Your knowledge base is going to be that. So, this is going to obviously a shameless plug to my program, but if you don't understand the business that you're getting into, then you're going to have a hard time entering it and succeeding. I am in the checklist certification phase. In the meantime, I'm using my funds for my part-time job to raise capital. Okay, well, you should consider raising some debt and maybe even raising some equity from equity partners if you want to speed that process up of getting more money on the books. In Virginia, the license application is $500. Cool. Godfecka 2009. Does anyone in this panel have New Jersey home care agency experience? And can you please speak on it? No, none of us do. But it's virtually the same in every state, right? You're going to either have your Medicaid clients, your private pay clients, your commercial insurance clients, or your Medicare clients. Home care is kind of the same everywhere you go. Is the license registration the same for Medicaid and Medicare patients? No. So the license registration is different for Medicaid and Medicare. Medicaid is a state-administered program. Medicare is a federal program. They each have their own guidelines and their own methods. Some states don't allow certain license levels to have one or the other. So no, they're not the same. They kind of can mirror each other in a lot of ways, but they're certainly not the same. And neither is the money. Medicare reimburses much more than Medicaid. I'm currently going through licensing process in Maryland. Is it okay for me to set up online platforms prior to getting my official license and temporarily deactivate them? I think you could set up websites to raise awareness that you're coming soon, that maybe you're consulting in the home healthcare space, and that's how you could kind of set it up, where you're working with people who may be interested in working in home care or getting home care services, and you just start building your lead list that way. I don't think there's a penalty in that, but you can't provide services up until you're licensed. So I don't see why there would be a problem with that. Godfika, good question. I'm also going through licensing in New Jersey and already built a website. I wonder if it's appropriate. I think it should be appropriate. Question, during the application and licensing process, is it okay to apply for survey in advance due to delay in feedback response from the state as a way to curb the waiting time? What happens if they show up that week? Let's just say for whatever reason, the surveyor is in that area or has an opening and you're not survey ready. So it's more important that you ask them what is their lead time than trying to squirrel around the system that way. Golden U, truth. What's up? A good foundation's a must. Gotcha. Yeah, absolutely. Gregory Jones, any tips on navigating a licensed home health agency certificate of need process? I've never been in a market that has the certificate of need. If I were, I would look for consultants who are proficient in that and hire them to work with me. But I've never done it. I'm pretty sure there's some sort of process for proving that there's a need in the area, right? And whatever that process is, they're going to have it outlined. But I would just hire a consultant that helps with that. Hello, hello. This is Gold. I'm glad you think so. God bless. Suggestion: if you're starting an agency with a partner, have partner go to CNA school. This can fill holes for services. Yeah, if you're going to be doing CNA work, yes, I would advise that. I became a licensed CNA and medication tech, so I fill in. I also, yeah, I guess it makes sense. If that's the sort of work that you're doing and you're able to pick up those shifts, then do it. But then again, you have to think about it like, hey, I'm picking up this CNA shift, and that CNA shift is only going to pay me X amount of dollars per hour. Is that worth it for the organization? Yes or no? Is it worth it for me? Yes or no? Am I now splitting my time too far to really focus on investing in my business, my time in my business for things that may be more lucrative? Golden Hue, we offer, I know Sean, she offers mentorship. I do on a limited basis. Right now, I will only have one client under service at a given time. And I don't do mentoring in any traditional fashion. When our organization mentors someone, it's going to be on a consultation basis or a access level that they purchase into if it's a program. For instance, I have a program called Killing the American Dream, which teaches people how to invest in 1 to 4 family real estate. So if you're investing in 1 to 4 family real estate and you want to be mentored by me, you have to invest in a deal with me. So I just completed a deal in Hillsdale, New Jersey with a Invest and Learn group. That Invest and Learn group came up with like a minimum of $10,000 per a member. We did a deal together. We sold a deal. The profit distribution gets distributed back to them. So they invest and learn at the same time. And I also have a monetary benefit from that. But it's not just, hey, you paid me to mentor you and coach you. No, you paid into the deal. And since you are invested in the deal, you're going to learn something, right? And you're going to potentially turn a profit. So that's how I kind of handle my mentoring. In my passive workforce program, we're going to be doing kind of like group sessions like you saw today, closed to premium members only, where there'll be more Q&A directly for that group that paid for that level of access. But to kind of just like take somebody, like the traditional sense of just one-to-one mentoring is really difficult for me just because the network has gotten pretty broad or wide or a lot of people. And my time is like really tight. Smiley face. Okay. Goodbye. Thank you for all the information. God bless you all. Blessings to you as well. I hope you were still here when I answered your questions. Thank you. You're welcome. Nehemiah. What are the most important KPIs in this industry? Also coming from a real estate background here, is there an equivalent to a pro forma in this industry? Of course. You can design a pro forma based on what you believe your census to be and the reimbursement rates in the sort of services that you're going to be providing. So you can always kind of manipulate that spreadsheet and make it dance however you want. Reality will be different than what's on the spreadsheet. I think some KPIs to consider clearly is your cost to acquire a customer, the lifetime value of that customer, the average monthly billing per customer, your gross margin, your net margin, your cost to acquire an employee by position group. I think those are really important. Your patient satisfaction scores, your hospital readmission rates, 30 day, 60 day, 90 day. I would say those are a few to start with.
How can you speed up the process of composing policy and procedures without spending tens of thousands of dollars? How do you get a goose to lay a golden egg? You know what I mean? Like, you can't, if you're looking to speed up anything, right? Express mail, flights versus riding around on a horse, it's going to cost you for speed, right? So there's no way around that. Thank you so much. It's been amazing. You're welcome. I'm glad that you showed up. I had someone offer to invest in my business. How much equity should be given? That's something that you need to figure out. Are they going to be silent? Are they going to be active? What are your capital requirements? Like, how much money do you need to get into the business, and how much are they offering? And what do you think that money is going to be worth to your organization long term? You know, like, are they offering you $10,000, looking for 50% or something absurd like that? Or are they offering $1 million looking for 7%? It really depends. Awesome, man. I mean, I hope you find great value in it. I think you will. And I think, you know, for those of you who are thinking about home healthcare or healthcare staffing, home healthcare is way more difficult than healthcare staffing, but both can be equally lucrative. I tend to steer people towards healthcare staffing versus home healthcare because it's less moving parts, less regulation, easier to get started, easier to make progress, shorter start times, that sort of thing. And the way that we've designed the course is that by the time, if you go through the course and you do all your assignments, by the end of the course, you will have a fully functional staffing firm ready to start soliciting contracts, right? Ready to start bringing business on the table. So again, you know, thank you for that. And yeah, I'm looking forward to your feedback to see exactly what value you got out of the course and how you progressed in the industry, and are you making money? What city are you in, by the way? Kabinja. Thanks, Karl. Appreciate what you're doing. Thank you for joining me. I actually appreciate people showing up for these lives, man. I remember if I went live, there was just me. We're hoping that somebody would come along and watch it later. So the fact that there's, you know, 20 some odd people in here talking and sharing ideas and even consulting each other in the comment section, that's really satisfying to me to know that, you know, I'm at least, I have an audience and people that are benefiting from my experience. Dev, what do you think of starting a healthcare staffing agency and later plugging in home care services? They're two different businesses, and that's how I got started. They're two different businesses. Starting in healthcare staffing gives you a good starting point for the administrative side of things. Managing payroll, managing invoicing, onboarding employees, sales, and just running a business that you're managing an active workforce, right? Home health adds an additional layer where you're now responsible for the care that's being rendered in your own organization. For example, I could send an LPN or LVN to a skilled nursing facility, and it's that nurse's license and that skilled nursing facility's license that's on the line, and their policy and procedures that have to be adhered to. In a home care agency, it's your license and your practice and your money. All those things are what, you know, are your liabilities. So patients who are dependent on you and your organization. So it's different in that regards. I'm a trained caregiver. Do you hire from abroad following from Kenya? I would, but it's a laborious process for the H-1B. So it really depends on what your skill set is and what our current needs are. But if you want, you can email me at info@aidbook.com. I just put that down below. That's the general email, but that goes to one of our HR personnel, and they'll kind of, be your first point of contact. I appreciate you, Karl. Let's see. I appreciate you, Karl. You are wise beyond your years, and I'm hoping to meet you in person. I live in Jersey. Thank you. Yeah, maybe one day. I think if I have a large enough following where physical seminars and workshops make sense, then I will do them. But until that point, I don't know what sort of following I need to have or per city for it to make sense, or what that would look like to promote an event like that and make it economically sensible. Or if I'm just hanging out in Jersey and we happen to meet up, then that would be cool. Golden U is still here. Well, I'm glad you are, because at least you got your questions answered and you didn't miss that. Thank you. Final question. We spoke about market research earlier. Where is a good place to find this information regarding patient volume and competition? Thank you for sharing. Patient value. Okay. One good resource for market data related to home healthcare is a company called Trella. I'm just going to post it, Trella. I use them, but it's more from a Medicare perspective. And I'm able to see, the Medicare billing trends per physician, per an area, per county. I could kind of slice and dice that data however I want. The software is expensive. I pay about $5,000 annually for it. And that's for 2 states. So $2,500 a state. Thank you very much. Thank you for joining us. Hi, I'm watching you in Arizona. I live in Naples. How are you? I'm doing very well. Thank you. Golden U, this has been really great. By the way, love the golden ratio logo. I actually thought about incorporating it somehow into my logo. Yeah, try it. If it makes sense for your logo, do so. I think that's pretty cool. But yeah, I think that takes it. That takes me out of here. Thank you, everybody, for joining me here at ENTP Life. This live edition has been pretty great. I really hope you understand what sort of valuable content was shared today. I know my channel is one of the few channels that actually shares insight into how to start these healthcare businesses. A lot of home healthcare operators are tight-lipped about what it takes to make it in this industry. They somehow think it's like, some secret sauce that they can't share with anybody. We share it, and we think that if people are just listening and follow these steps, that they'll do very well. So, I hope you really understand that this is valuable content. Usually when I consult one-to-one, it's $450 an hour, which is, akin to attorney fees or accounting fees or physician costs or whatever. But I have more than 20 years working in this industry, so I would say I'm doctorate level at the information I'm sharing, and it's valuable information. So when someone like myself and someone like Sean comes on and they're given their insight, it's really valuable insight that's being given for free. We don't hold back on the details. We really encourage you guys to take our tips and act on it, because it's really how you process that information and what you do next that's going to determine whether or not you're going to benefit from what we're saying, right? So that's entirely on you. Anybody else who's looking for longer content, more structured, looking to start a healthcare staffing firm, this is your nursing agencies, your physical therapy firms, dosimetry, radiation therapy, nurse aides, you name it. It could even be outside of home healthcare or healthcare itself, because the same principles apply to all industries. If you're interested in starting a staffing firm where you're able to build a company out, hire and employ, dozens to hundreds of people, and eventually start earning passive income so you could go out there and live your dreams where you're not, tied to a job to make money. You now have a business that's producing money for you. Please take the time out, really think about whether or not you want to sign up for my course that's coming out June 27th. Low cost to enter. It's only $97 per month for the basic membership. You could learn, in a maybe 2 to 3 month time, get completely set up and start one of these businesses of your own for very little money. Once again, thank you for joining me here at ENTP Life. I hope you enjoyed. I hope you gained a lot from it, and I'll see you in the next one. Take care.